Hello beautiful peoples, Dr. Ahmed. We're back again with another video. Today, we've got the beautiful, say your name.
Alyssa.
Teamwork, huh? So what treatments are you interested in?
To be honest, am I allowed to say I don't know? I don't know. I don't know what I'm interested in. It's not something I've had done before, so I kind of just wanted to talk to you so you can tell me what's going to fit my face best, really.
I think that's a great way of being. I think being open-minded is really important in these treatments because obviously with the internet and social media, a lot of patients come in with a very specific idea of what they want. That is great in some situations, but sometimes, as a doctor, when I assess the face, I'm like, well, actually, that's not the right treatments for you. What you need is 1, 2, and 3. And this is why the consultation is so important. So when you look in the mirror, what are the areas that kind of draw your eye, positive or negative?
In terms of the things that I'm not a massive fan of,
Sure.
it would be the kind of the lines I've got here on my forehead, which I don't think they're super noticeable, but once you've seen it in yourself, it's kind of hard to see past it. I don't really like the bags. I've got a little bit of I can see bags under my eyes, which I don't love. And I think this area, this kind of chin area, I just think is a little bit more full than I would like it to be. So those are the things that I've kind of come in thinking that I'd like to change a little bit if possible.
How do they make you feel, these areas?
I mean, it's not something that massively affects my self-confidence, but I feel like having them altered a tiny bit would just help me to feel better, kind of without having to put makeup on and things like that and going out with a fresh face and not feeling the need to do that, which would make me feel a lot more comfortable just daily. That would be great.
So you mentioned you've never had any injectable treatments done before. Was there a reason why you've never had it?
I didn't know what it is I would need for the issues that kind of are bothering me. I've never talked to someone about it. It's not something that I've ever really got advice on, so I wouldn't have been able to go to someone and say this is exactly what I need to make me feel better. So yeah, that's why I needed someone to kind of talk me through it, really. I didn't know what I was doing. So yeah, that's why so far.
So now that we've discussed the treatments, do you have any questions about these treatments?
Is it gonna hurt?
So we're going to be using numbing cream. So the pain will be about maybe 2 or 3 out of 10. The area around the eyes, sometimes people can find it a little bit sensitive, but actually a lot of that sensation is more pressure than pain. It just feels like someone is tapping it gently. So the good thing is we're not going to be doing any injectables around the eye. It's more of a cannula. Do you know what that is?
Kind of. I think I do, but not really. Probably not. Is it like a little tube?
Yeah, so it's a blunt tube, teeny tiny, so the tip of it is blunt. So say if it comes across a blood vessel or a nerve, it usually goes above it or below it, so it doesn't cause any damage there. But obviously still we're going to be extremely cautious, but I think the results will be absolutely fabulous.
Lovely. Oh, I'm excited.
Should we get the party started?
Yeah, let's do it. Let's do it. So on the consent form, it does ask about smoking. Is that an issue in terms of getting treatments done?
Sometimes when people smoke quite a few, what the smoking does, the nicotine and other chemicals, it reduces the blood flow to certain areas, so it can impact healing. And this is why ideally I'd want patients to not smoke, well, at all ideally, but a few days before and then a few days after, just so it really doesn't impact any of the healing, especially after kind of major treatments that we can do sometimes. So at this stage, I just wanted the patient to sit up a little bit so we see things with gravity, because that really shows you exactly how different areas and different structures sit. So we can see slight flatness here in this area and then some hollowness in the under eyes. So we're going to be creating a bit more, essentially it's like scaffolding for your face. So it's this area here, we're going to be lifting it up. So we're going to be injecting along the cheekbones that way to create an anchoring point that way, and then a little bit in the temples area. So I'm sure some of you will know this area has got a very important blood vessel, and that's your temporal artery. That's a major one really. So make sure that you palpate it, which means you feel the pulse, which I can feel it right there. So we avoid the area. So now that we're all done, time for the big reveal. So tell me, what are you thinking?
Oh my gosh. My chin looks so much better. I have cheekbones. Oh my gosh, you can literally see it. Oh, you can see my cheekbone.
Yeah.
I've never had cheekbones like that in my life. It looks so good. Thank you.
You got the giggles now.
No, I do, but like, honestly, look at that. Like, my cheekbones look so high.
But it's quite natural.
Great,
Basically,
yeah.
It's similar when you're putting makeup, you know how you can contour? We basically did that but from the inside.
Yeah.
So we went along your natural cheekbones, just lift them there. A little bit along the chin and the marionette lines just to hide the slight kind of, pocket of fat there.
Yeah.
And then around your eyes, how does that look to you? Because it looks amazing.
They look so much they look brighter.
Yeah.
It looks like I look more awake. It's great. It's so good.
So we got rid of the hollowness in the under eye with a touch of dermal fillers in the tear troughs area, and then a little bit in the kind of front and side bit of the cheeks, just to lift things a little bit as well.
It makes me look like I've slept for about 20 years. I just look really refreshed. It's great.
Hibernation for 20 years.
Honestly, I don't need it now. I can carry on. No, this is great. Oh my gosh, I can't believe my cheeks. Thank you so much. It looks amazing. It looks so good. It looks so good.
So do you have any questions for me?
So how do I kind of make sure that this heals as well as it can do, and how long is it gonna take to heal?
I always say it takes up to kind of 14 days or 2 weeks for things to fully settle, because you can get a bit of pain, a bit of swelling and a bit of bruising in these areas, and that's absolutely fine, particularly around the eyes, so that's nothing to worry about. If it does develop, I will suggest taking some antihistamines, because that really helps kind of calm down any swelling. You can get these over the counter. I will suggest avoiding any makeup or any kind of skincare for the next 24 hours. Sleep on your back as well for the next few days, just so the pressure of the pillow doesn't move anything. But usually things settle, within the next few days, but up to 14.
Okay. And how often, to be able to kind of keep up with how amazing this looks, how often would I have to get the treatments?
General rule of thumb, any treatments on bone, like the cheekbones, temples, the chin, will last for up to sometimes even 2 years. However, treatments around the mouth, like the smile lines or the marionette lines, that will last for about 6 to 12 months. Under eyes is a bit of an exception. It can last for up to 18 months sometimes.
Wow.
Yeah, so quite a while really.
Oh, amazing.
Especially if you're using good quality products, they last.
Amazing. Thank you so much.
No worries at all.
Thank you.
That wraps up today's video. We'll link all the treatments down below. Please subscribe, give us a thumbs up, and follow us on all other social media channels.